And we are live on YouTube.
Okay, you tell me when you have most people in and we'll start.
I think you can go ahead and start.
Okay, great. Good morning, everyone. My name is Leslie Kirby, and I'm the chair of the Community Relations Committee of the Jewish Federation and Jewish Foundation of Nashville and Middle Tennessee. We've been sponsoring these weekly Lunch and Learn series to try to keep the community connected and informed during the time of COVID. Today, we have with us two special guests, State Representative Ron Travis from District 31 and Sally Smallwood from the Coalition of Strong Tennessee. And they're going to be talking with us about their efforts to bring 1.4 million Tennesseans tax dollars to help the state healthcare infrastructure and to protect 300,000 of our uninsured neighbors. We're going to start with Representative Travis talking to us a little bit about both his personal and professional connection to this. And then we'll switch over to Sally to talk about the Coalition for a Strong Tennessee. Representative Travis.
Thank you, Leslie, and welcome everyone. And it's good to be with you today. I'm Ron Travis, and I represent District 31 in Tennessee. And last year, I carried a bill, which was Bill Haslam's bill that he ran back in 2016, 14 and 16. And, you know, the executive branch worked on this quite well. So the bill was already in very good position when I filed the bill. And it was Insure Tennessee. As most of you know, the Affordable Health Care Act that happened back in 2012, it had a loophole that the states were to pick up. And that loophole was to insure the working people of Tennessee that made below 138% of poverty. When it started back in 2012, the federal government give 100% of the money back to Tennessee to cover these individuals, what Leslie said, the 300,000 plus what we have today. And states did pick it up. Right now, there is 39 states out of the 50 that has the Medicaid expansion. We're one of the few. Most of the southern states, for some reason, has not picked that up. So today, at present time, the federal government gives us 90% and we pay 10% of the Medicaid expansion. And you know, when I ran this bill, I knew it was going to be a struggle. I didn't know it was going to be quite the struggle. So, you know, today, as I sit here last week, I met with 3 or 4 of my colleagues over there, trying to get them on board, and I think I have them on board for this year legislative schedule. And I give you, when Bill Haslam presented this bill to the legislation, he worked very hard on this and very diligent. And I thought it was a great idea then. It was just that there was a lot of people that did not. The House never got to vote on the bill. The Senate killed the bill in their committee, so we never did get the chance to vote on that. But Governor Haslam's gone now, and I've picked up his bill, and because I do believe in it, and I'll tell you why my story is that why I do believe in it is last Thanksgiving, my sister-in-law, she got sick, and it was a couple days before Thanksgiving, and Sheila did not have a health care plan, so she thought she was a flu, and she just would ride it out. Well, it was more than the flu, and 4 days after she got sick, her husband did have to carry her to the hospital, and I mean physically carry her to the hospital. And we had a funeral 3 days later. She passed away in the hospital from sepsis. And if she would have had insurance and had a copay or a deductible without having the expense that I feel comfortable, 2 days earlier, she would have went to the doctor and probably been with us today. And So that's one of the reasons that I felt passionate about it, carrying this bill. And in the meantime, I got a letter with no forwarding address. It was just a letter, and it was written on some paper. And it was a guy named Tom and his wife, Sally. I think it was what I tried to locate the letter today, but I couldn't find it. So I'll have to look that up. But he was telling me his story. He is an auto mechanic, and he makes about $14 an hour and works about 45 hours a week. And he only gets paid for the work that he does because of a mechanic. He has two sons, and I think there were 14 and 12. And he got sick one weekend, and he went to the emergency room, and the doctors told him at that point that they done all that they could do for him there, that he needed to see a specialist. And that's what he didn't have the money to do that. So today he was telling me in the letter that he was just trying to work through the pains that he has. And the letter was so moving and so touching that, it was just, it was just stayed in my mind to this day. It stays in my mind because, his son, the 14-year-old, said, "Dad, I will go get a job and help pay for this specialist that you have to go see." And it just went on and on to tell their story. And, there's just so many stories out there like that today. I get a little teared up on it, but there's a lot of stories out there that we need to take care of the people that are working. And this is the people that are working. The Tennessee the insurance plan that we've got put together has a copay, just like my insurance that I get from the state. It has work requirements to take care of, to make sure the people are working that has this plan. And, today there's 39 states that have expanded Medicaid, which leaves Tennessee and some of the southern states not expanding it. And if we look at all the documents that's been prepared, really and truly, it's not going to cost the taxpayers of Tennessee any money. The Tennessee Hospital Association, under Governor Haslam's plan, was going to cover the 10%, because, as we know, if someone goes to the emergency room without health insurance, they're making below 138% poverty. Chances are they don't have the money to cover that expense from the hospital, so that hospitals end up writing it off. And there's a lot of mental health and substance abuse that we struggle with in Tennessee that this expansion of Medicaid could cover that expense, because Tennessee, we spend a lot of money in that area right now that could be going towards the 10% if we had to pay it to cover that expense for people. And that was one of my big points, my sister-in-law and then Tom and Sally's letter that I've gotten, and just so many more people have come up and talked to me about this and their situation. So I know we have quite a few people on the phone, and I would venture to say that somebody on this call today has seen a situation like this, or someone that does not have insurance that's working a job, but they're fall below that 138% poverty level. And so I think it's time for Tennessee to step up and take the responsibility of these working class people that we have left out. And I can't imagine to this day that if someone told me today that I would not have health insurance coverage in December, I would probably panic, stress out, and probably never sleep again in my life. But I just think it's a thing that we need to talk to our caucus about, and making this happen in Tennessee. So Leslie, I think that is my point. And
Thank you for sharing your story. I'm very sorry to hear about the loss of your sister-in-law. I think we're going to move to Sally for right now and let her talk for a few minutes, and then everyone on the call, if you have questions that you'd like to ask for either of them, put them in the chat, and then we'll moderate this once Sally's done. Sally?
Okay, so I have a question, so I want to be the first one in, but when we come back to Ron, I'd love to know, because 4 other representatives, Republican representatives, ended up helping you sponsor that bill. And I'd love to know how they came on board and how you see getting some others on board. So, but I'm Sally Smallwood, and that's part of what the Coalition for a Strong Tennessee does. We formed around the time that Governor Lee was elected, because we saw that we are going to have some bipartisan advocacy and support for bringing all of our federal monies home for comprehensive health care coverage. And that's kind of our mission. And so it's based on a Virginia model that gathered a bunch of organizations together to advocate and support and be a force. And they had 100 organizations. We're at almost 80. So we're still building, got another one this week. But we are only active when there's an opportunity. So when Representative Travis did his bill, we were very busy sending out emails and connecting with legislators and that kind of thing. Our website is bringourtaxeshome.org. And if you go to it, you can see a lot of facts and figures. Like, so far, we've lost access to $8 billion that would have been ours if we had expanded when it was first available. You know, it's a lot of money. And what the studies are showing with the money, I'm going to talk about that just a little bit since Representative brought it up, but what the other states that have expanded, there's so many now that have done it, and we've got such good data. And there's a recent study with the Kaiser Family Foundation that reviewed over 400 of these studies and did a comprehensive review, and it was all extremely positive. And what they're finding with the money, yes, the Hospital Association offered to cover the 10% of the 90-10 match, but what happens is a lot of these folks that are under the regular match, which is 70%, 35, state pays 35%, 65, 35. Those folks qualify for the higher match, so the state saves money. Inmates, some of them qualify, so the state saves money. You start to have hospitals with covered patients, so you don't have the network, the safety network funds and some of those things that the state is helping with because we haven't expanded. That saves money. There's multiple examples of that. So the money doesn't really seem to be an issue as a selling point, because there's no cost to Tennessee. In fact, there may be considerable savings in numerous areas. So then it gets down to, so what is the stumbling block? And that's why I'm excited to have Ron on board, because I really think he can give us some insight into that. We, from the coalition standpoint, our angle has been to point out it is our money. I mean, that money's being generated in various ways in Tennessee, and it's our money, and we should be using it, and we need it. We're #1 in medical bankruptcies. We've got a horrible opioid crisis. We've got 51 mothers who, because they didn't have postpartum care, died, and their children have no mother. We have examples of this across the board. And what you're finding in the research, and I'll go back to that Kaiser Family Foundation one, is that those things are not happening in states that expanded to the extent they are in states that didn't expand. There is a lot of research now, and one of the most compelling is the mortality rate. The states that did expand, the lives that have been saved equal to kind of what seatbelts did for us. Whereas using the same data, over 1,000 people have died in Tennessee needlessly because they didn't have access to health care. So that's very compelling. It's, well, you know, Ron told you some very personal stories, you know, times 1,000, times many more for others. So that's kind of the coalition's passion and where we're at.
Great. Thank you both for giving us a little bit of an overview. We have a couple of questions coming in now, so I'll kind of reframe what you asked earlier, and that is you got 4, I think you said, other colleagues on board. So how does that happen? And then that relates to some of the other questions that we're getting in the chat, which is, what are reasons that people are giving for not being supportive of this? So in other words, how did it become, to some extent, a partisan issue? What's the holding back? So when you have actual conversations and dialogues with colleagues, what's the holdup here? They surely must know the need. And so what's keeping more, why isn't everybody on board with this project?
Are you coming to me, Leslie?
I am.
Am I ready? Can you hear me?
Yes.
Okay. And Sally brought up some great points, because the work is good and it works. The Medicaid expansion does work, and it is very cost efficient to the state of Tennessee. And I really believe in my heart that it will save lives. It will give people better health care. It will keep people out of the ER rooms. And it will just do all these wonderful things that Sally mentioned a while ago. And yes, and to answer Sally's question on that, I did have 4 representatives last year, and 2 of them will not run again. So I have to work a little harder finding replacements for them. And we had a meeting. I had a meeting 2 weeks ago, and I have picked up 3 more Republicans that are very interested in this. And then I've been asked probably about 5 more that, hey, I need to learn more about this Medicaid expansion in Tennessee. So that's going to be one of my goals this year in the legislative branch, is to educate these people, to our people, my peers, that this is needed. This is very much needed in Tennessee. You asked the question, or someone asked the question, what is the reasoning behind people not getting on board? And if you look back on it, and I wasn't in legislation the time this happened, but probably about 12, 14, 16 years ago, they had to reduce its TennCare population.
Mm-hmm.
And that give a lot of heartburn to representatives, to having to take these people off of a TennCare program that had been on there and their health insurance. But you go back and look at that, it wasn't managed right. It wasn't done right. We didn't have the Affordable Health Care Act at that time, where the federal government was giving us this money to support that. So we had to take people off of the rolls. And I think that's stuck in people's minds. What happens if the federal government defaults on this 90%? What do we do at that point? And one good thing about the Insure Tennessee plan is that it's got a safeguard for that. So if something happens and the federal government does not pay the 90%, of course it would bankrupt Tennessee if we had to pay the 100% of what we want to do. It cancels the bill. The bill goes away, and no one has to do anything. It goes away. It dies. And so that's a protection on that. So I've just got to get my peers to see that we've got all the bases covered to make this happen, to generate this, and to give, again, it's that working class people. It's not the people that does not work. It's that working class people, and it gives them insurance coverage to protect them and their families.
And I would just add that some of the roadblocks that I saw too was there were leaders in place who wanted to run for higher office. And so they didn't want to be doing Obamacare.
Right.
You heard there was funny money. I heard the TennCare also, the roll off with the TennCare had been just traumatic for everybody. But there's a system in place, like you said, for that now. And so I think a lot of it just came down to the key leaders at the time. Like you said, the House never got to even consider it. And Beth Harwell was the Speaker of the House at that time, and she was wanting to run for governor, and the people that were going to be funding a lot of her campaign were very much against it. So, I mean, there's just different politics in play, and I think they're different now, but I still think a lot of it is politics, because like you say, the return on investment for this money is staggering for for helping our state and our citizens.
And I would like to add to what Sally just said. It is staggering. And another reason that the legislation, we applied for a block grant almost a year and a half ago, and that hasn't come through. So the legislators are saying, well, we got this block grant up there.
Yeah.
Even if we get the block grant, we're not going to get that 90-10 match.
Yeah.
So, it doesn't make sense that we can move on this today and it becomes real. It's something that we have. It's tangible. It's here. It's ready to go. No more need is done. So everything's done.
Well, and a lot of folks that were opposed to the block grant have unfortunately been proven very right in the last few months, because block grants don't flex if you have a pandemic. Block grants don't flex if you have a recession. And like when the vaccine is available, block grants don't flex so that you could cover that vaccine for everybody. So we have 3 perfect examples of why block grants are a really bad idea. But we have a legislature that got pretty excited about it. And we don't, and it's easy. We could pull that block grant any minute. We don't have to do it once, even if they approve it, we can deny it. I mean, it's not a done deal. And I'm not remembering the state that just recently expanded, they voted, and it overrode their block grant application. So that kind of took care of that.
Let's back up just a little bit and talk. For some of the people on the call, there may not be a good understanding, or when we talk to other people, what is it that prevents people in Tennessee that you're talking about helping from having insurance right now? So are they not able to get it through their employers?
They're in low income jobs. They're in part-time jobs. They're your restaurant servers, your construction workers, your musicians, your folks like that who work at jobs. They're either self-employed, they're underemployed, they're doing 2 or 3 part-time jobs instead of full. I mean, it is in the employer's best economic interest to hire a couple of part-time people than one full-time and cover their health benefits.
And to add to Sally's again, Leslie, is that she's exactly right. She's nailed it on the head there. But if you take a family of a 45-year-old male and a 45-year-old female, the cost of health insurance, even a $2,500 deductible policy today would run them in the neighborhood of $500 to $600 a month. I mean, that's more than their house payment. That's more than their car payment. That's more than their probably grocery bill.
Mm-hmm.
So it's a very expensive thing. I mean, since the Affordable Health Care Act, we've seen health insurance rise at 250, 300%. And like Sally said, these guys that's working $15 an hour, the money's not there. Whatever you do, you can't buy it. If you wanted it, you can't buy it.
I think that's important to get out to people, because I think a lot of people who work full-time for larger businesses don't understand that not everybody can just buy their health insurance the same way.
Well, and to that point, they should care, because don't you want the person serving your food to be healthy?
Yeah.
Um, are you familiar with the book Dying of Whiteness?
Yes.
Okay, so
Ron, have you read it?
No, I did. I tried to Google that. I tried to go on Libby and find that book so I could read it for days because I knew that was going to be brought up.
Yeah, because I think he nailed it on the head with some of the issues here in Tennessee.
So in what way? Can you talk a little bit about that? Because a lot of people in our group, we did a community read of it, and so they're familiar with the book. So
Oh, well,
how does it affect this conversation?
Yeah, maybe they can answer it better. The way I read it, and I would please y'all chime in, was that the Affordable Care Act and has been defined to Tennesseans as so for welfare queens, and that was the exact word that was used and stuff like that. And it's not given the clear picture of who would benefit from it, and that their identity was, I'm working hard, not so other people can benefit, and not realizing that they're the ones that could benefit. I mean, with our population being 70% white in Tennessee, that's who is going to be benefit, and hence his title is they vote against the things that would actually help them, more white people help them because they see it. And so that really speaks to a lot of the racial disparities and issues that we're seeing now across the country. Is that, Leslie, is that how you would describe it?
Yes, I would say so. And yeah, we could go into a longer discussion about the book, but I think that gets the gist of it. We had a follow-up question about the Affordable Care Act. So why can people, so these thousands of people in Tennessee that you're talking about now, why didn't the Affordable Health Care give them the ability to buy the Affordable Health Care Act? Why did that not give them the ability to get insurance, and wouldn't they get a subsidy? So why do we still need this?
Not if they're in the gap. So, you have to be making a certain amount to go online and on the exchange and afford that insurance. But so there's these people, that don't make enough to go on the exchange and buy insurance, and they're not, on some other kind of really below 100%. So they're in this gap. It's these part-time workers that don't have the money but don't have the subsidy. Is that how you would describe it?
Oh, yes, Sally, that's it. Of course, I want to blame the federal government for that because they've left this gap out there.
Mm-hmm.
That gap should have never been left out there and give to the responsibility of the states. I agree. Let's give states more responsibility. But hey, when it comes to affordable health care, you can't do that because we see right now, 11 states, where there was 12 until what you just said a while ago, somebody else expanded theirs, that did not do this. So now that gap of people are just left in no man's land.
Mm-hmm. Mm-hmm. So basically it's people who are living below the poverty line, or what's the actual cut point, would you say, for being able to afford?
Below 138%. So, you have a poverty level, and I don't know, Sally, you probably know the number on this, but let's say if you had a single mom making $17,000 a year, she would be in that gap. Is that right, Sally? Is that number close?
Actually, I'm going to our website right now because I just updated the numbers, and I can tell you exactly what it is. In a minute. Okay. They have incomes less than $17,236 for one person, or less than $23,335 for a couple.
For a couple.
So it's kind of in that range. It's between 100 and 138% of poverty.
So it's our poorest citizens who can't get any health care.
The poorest working citizens,
right.
Yes.
Well, and that's why there's been this domino effect. So a lot of them live in rural areas, which is why they're losing their rural hospitals. And what's happening now with this pandemic is the other hospitals are getting stressed because they have their communities plus these other communities more, as people are becoming more unemployed because of the recession, you're seeing more hardship on the healthcare structure here. So we have some serious issues. And at one point, I think it was in March, and I'm sure it's much higher now. I got to look at 52% of Tennessee's remaining rural care centers were in the same financial situation of those that had closed. So it's our healthcare structure. It's certainly our uninsured Tennesseans, but it's also the racial disparities and that aspect to it. And then it's also jobs. Governor Haslam's plan had 10 to 15,000 jobs, depending on whose research you look at, mostly in the healthcare sector, but we need those jobs.
We had several questions kind of aimed around a similar theme, which is who do we need to talk to? So who in the legislature can we contact? Are there people that you're, I don't want to say targeting because that seems kind of harsh, but are there people who you think might be receptive to this message that we could help contact? And what's the message other than you should support this? Are there particular talking points that you've been finding more or less effective?
Can I take this one, Sally?
Please.
This one is a real big key, because I tell you, when I have a group that mass email me the same document, I'm going to tell you, I'm going to read the first one, maybe the first two. The other 150, I'm going to delete because I know what it says. It's already there. What I would do as a voter, as a constituent, I would find out who my state senator is. I would find out who my state representative is. It's online, and you go to tennessee.gov and you can look your legislators up. And I would make a phone call to that office. And I would say in my phone call, I would keep it personal. I would say, what are you going to do about helping the working class on their medical insurance? What is your position on this, and tell me why? That's what I would do. I would keep it very personal, and I would hit it. I guess this group that we're talking to today is all across the state, correct? Or is it located in one area?
This has been open to anyone, but most of the people on our call are from Nashville. So part of why people are asking is most of our representatives are already supportive of this. So we're wondering if we can help with others.
Yes, we'll have the group reach out to their family, their friends across the state of Tennessee and say, this, as a group, this is what we need to do. We need to contact our representative or senator and say, where do you stand on Medicaid expansion, helping the working people have health care? The Insure Tennessee is a good program. I mean, it is one of the best programs that I have really seen. I think it's probably one of the best in the country. And have them call that person up and say, hey, I'd like to speak to Ron Travis. Could you have him call me back? I want to ask him about Medicaid expansion. If you call my phone number at my office and ask me to call you back, I'm going to call you back. And if I don't call you back, I'm really not doing my job. Now, don't leave a message. Ask for the call back. Call me back. I'm a constituent and I have a question. And that's the way I would do it, Sally. We can, and Sally will shoot out emails and all this, but if you give them that personal touch, all we need is 26 representatives. All I need is 26 yes votes, and I can pass this.
But don't you also need Speaker Sexton and Randy McNally? I mean, aren't they?
Oh yeah, yeah, they're crucial. They're crucial.
Will they only listen to their constituents, or can anybody, when they're calling their representatives, should they also call each of them?
Well, if I were to call if Sally would call Speaker Sexton and say, "Hey, this is Sally. I would like to speak to Speaker Sexton or Lieutenant Governor McNally, or, you know, someone that sits on that insurance committee,
Mhm.
and talk to them. You don't have to tell them you're their constituent. All
Mhm.
you have to do is, you know, I I I want to know what's your opinion on Medicaid expansion. Well, what is your opinion? Why you like it? Why you don't like it? I would just like to know as a Tennessean. That's what I would do, Sally.
I think that's wonderful. Thank you for that insight. I would just say, from the coalition's perspective, we're working actually on Governor Lee. And so it's
Yeah, he needs.
a nice team, because no state has brought that money home without having the governor either supporting it or saying they'll get out of the way.
That's right.
And he's new to politics, and he doesn't, there's no way he understands this issue as fully as he needs to. And so actually, Martha Ingram and I have requested a meeting with him, and they're looking for a date. They've been looking for a date for a while, but I think I've been talking with people in his office, and we are getting closer. And in preparation of that meeting, and I'm going to invite everybody on this call who hasn't participated to participate if they would like, we have gathered statements from organizations across the state, and they're personal, and they're to the organization of who they serve and how this would be a game changer for them and the issues. And it's enlightening across so many areas. And so if you're on this Zoom and you have an organization that would like to participate, go to bringourtaxeshome.org, and then the contact section, just sign up as an organization or an individual, and I'll reach out to you. I'll send you the document if you want, and you can see. And Ron, I probably ought to send it to you too, so you can just see what's going on in this direction. But I think we're at 14 pages now, and we've got everything from taking care of veterans to mental health to opioids to mothers to whatever it is. And it's a wonderful, I think it would be a wonderful tool for him if we can convince him. The other thing that we're trying to do is to suggest to him that it be titled a recovery plan, because we need a recovery plan to get out of all of these issues now, and bringing that money home would address each one in significant, impactful ways. And so we've hooked his office up with an economist who's helping them have conversations around that. So really, with the broad organizational standpoint, working on the people around Governor Lee and Governor Lee.
And Sally, would you tell me one more time, what did you call that? Recovery plan?
A recovery plan. It's, and it's kind of like Insure Tennessee. If you don't call it Medicaid expansion or the Affordable Care Act, if you call it some kind of Tennessee term, it seems to go a little further.
Yeah, I like that name, because I don't know if we're going to have to change the name of the bill from Insure Tennessee or maybe Tennessee Recovery Plan. I like what you said, so that's why I wrote that down. That may be a new one for me on the next bill.
Well, I'm hoping, and Ron, you say, my goal is, I think the governor has some power now with his emergency powers.
That was actually one of the questions that we got. So is there any of this that Governor Lee could do via executive order?
No, he can't, because we passed a law when this came out in 2013 that says he doesn't have the authority to do that. The legislative will have to do that. But we have what Sally said. I don't think Governor Lee is on board with this plan. So we need to get him on board with this plan, and then we need to run it through the legislation to get this passed.
You don't think the emergency powers thing that was done for the pandemic that was you were talking about the Jeremy Durham bill?
Durham, yep.
Yeah.
That's what I'm talking about. I don't know, Sally, but I don't think it would. It may be a temporary thing, but I don't think he could do a full-blown Medicaid expansion.
Okay.
I don't think, but I could be wrong, but I really don't think his authority will
We'll
go
do
that.
that.
Representative Travis, we got a follow-up question just to ask again. So if people in Nashville wanted to call other representatives in the state, would they be receptive to out-of-district calls, or should we focus our efforts elsewhere?
Well, when you call a representative's office, if you call my office, and I give you an example, a lady called me the other day, and when I returned her call back, I didn't realize she was not even close to my district. But I helped her anyway, because I mean, I'm a representative. So I helped her with her situation. It was about a flood policy that the coverage didn't work. So I helped her work through that, but she wasn't my constituent. But I did find out she wasn't my constituent. You know, I would probably make the phone calls. I mean, like I said, I got 3 new people working right now. I see Mark White he's from Memphis. You know, he's interested on this. Golly bum, the names are just Sam Whitson is one. Sam and I have talked about it. Sam is very interested in it. And you know, I think we'll have about 7 going into the legislation this year that we can at least know they're interested. They want to learn more about this, because some of them are new. I mean, we're getting 7 or 8 new people. So we'll talk to them. But like Sally said, if you don't have the leadership involved, it's going to be a hard sell.
Mhm.
Other questions that people have, I've been trying to keep up. More discussion of the book. So people are asking, would you be willing to send us a list of names, either one of you, of people that you feel like are most callable on this issue, so that we could gather our efforts? And then somebody's asking, have you spoken with Representative David Hawk?
I have. I have talked to David. I talked to David probably about a month ago on my drive into Nashville, because he chairs the 10 care committee, and that's where this bill will come through to get out of sub. I've talked to David. David is in. He's stuck on this block grant, and that just absolutely kills me, because like Sally said, it is so limited. If we do get the block grant, it is so limited to what this plan is already there for. So I haven't given up on David. I think David is a good person to talk to, because I think he sees the necessity of this. That he may want to take a different route, but I don't think that path to the block grant is what we need. I just really don't think that path. I think it's more of a Band-Aid than it is a fix.
Well, and it goes back to kind of what I said was good. It's kind of like this politics thing versus this research, based on research. It's kind of like, this is how fiscally responsible we are, versus actually it's more fiscally responsible to do it this way. I don't know. I mean, because I guess I've had a hard time understanding too the lure of the block grant.
Yeah, and me also, Sally. I wasn't a fan of the block grant, because we had a fix.
Mm-hmm.
It was the best fix.
Mm-hmm.
And so, you know, maybe it's kicking the can down the road. I don't know. I don't know what it was that they're thinking about that
It'd be very interesting to see though if Representative Hawk feels the same way now after the pandemic, the recession, and when we get the vaccine.
yeah. Well, you know, like I said, I talked to him a month ago, and I told him, I said, the block grant is probably dead. I mean, if we haven't heard anything, come on, if we hadn't heard anything in 14, 15 months, chances are, is it really going to happen? I mean, we got an election coming up in November. What's going to change at this point in the game?
Mhm.
So I hope David will come around. And like I said, you know, we can't pass anything until January, and hopefully he'll come around and see the light. But that's what we have to do. If we have to work that committee. So, you know, if the people on the line wants to go to Tennessee.gov, pull up a committee, the 10 Care Committee, look on there who serves on that committee. That would be a great starting point at that point, is finding those people that work on that committee and be nice about it and say, hey, you know, the working people of Tennessee needs this Medicaid expansion. 39 states have done it. Let's bring our money back to Tennessee and help make this state a more healthier state. And there's just so many pluses to this that I can sit here and think of millions. And I just think we need to do it. It needs to happen. And it will happen, but when will it happen? How many people have to get sick? How many people have to go without health care before this really takes place?
Mhm. Somebody suggested also that asking candidates where they stand in advance of the election would be a good thing to do to let people know that there's concern. We also got a question a few minutes ago about using clergy. So some people have suggested contacting clergy in the districts of these areas where we think people might be more malleable. Are people more responsive to clergy than to regular constituents? Is that a good strategy, do you think?
Well, it's not a bad strategy. I had a clergyman in my office thanking me for this. I had a physician in my office thanking for me for this. As a matter of fact, I went to a doctor's appointment the other day. Cost me $45 copay. He looked at my arm because evidently I picked up some stone the other day and pulled a muscle in my arm. Charged me $45, looked at my arm for 8 minutes, and talked the other 45 minutes about Medicaid expansion. So they're serious about it. They know the value of this. And it's not to protect them, it's just to protect the people of the working class.
Well, and studies show that over 70% of Tennesseans, Vanderbilt's polled this, want Insure Tennessee or expanded, whatever Insure Tennessee is usually I think what they call, but they don't vote that way. You'll have two representatives running, and that's the dying of whiteness thing. And so truly, it would be great if we could just find a bipartisan way to get forward with this and kind of not have it be so divisive and partisan.
I have to agree, Sally. I'll have to agree with that. It should be a bipartisan solution.
Mm-hmm.
So we just need more Ron Travises in the legislature.
I don't know about that, but we need more people that want to see Medicaid expansion passed.
Fair enough. Are there any questions that I've missed looking at the chat? At this point, if you have a question, why don't you just unmute yourself and ask it directly? That way we won't miss anybody since we're wrapping up.
And while they're doing it, I'll just add back to the clergy, we have a number of denominations that are part of this document for the governor. So that are part of the coalition. So if you go to bringourtaxeshome.org under coalition members, you can see everybody who's a member, and a number of them are religious groups.
Got it. I think he was asking more specifically about having the particular clergy that the
Absolutely.
representative affiliates with talk to
Yeah.
them. Yeah.
But there's lots of ways for those voices is what I'm saying. Yeah.
In another way, instead of a phone call, we go back in session in January, and I don't know what the public is going to be allowed with the COVID right now. I don't know what's going to take place in January. But if you could find that, you go online and find out who's on that committee, the Insure Tennessee committee, and maybe go in their office, ask for a meeting, go in their office and just say, hey, I'm Ron Travis, and I would just like 3 minutes of your time to tell me what your thought is on Medicaid expansion. Why do you don't like it? Why do you like it? What do you see in the future to help these people? So, I mean, we're very receptive about people coming into our office. I mean, that's what we do. We represent the state of Tennessee. There's 132 of us. That's what we do. So, I mean, I can't tell a person from Bristol, Tennessee, I can't talk to you because I don't represent you. That's not what we do. That's, we do have a passion for what we do. And I think all of us have that passion. So if it's available, make the trip to Cordell Hall and talk to us. And in the first couple of weeks of session is the best time because, we're getting our bills online. We don't have all these people running into our office finding out, but we're receptive to that. And I can tell you right now that I don't know what the percentage, Sally, you probably know what the percentage of the people in Tennessee believe in this, but every person that has come into my office, I see 3 people walked into my office last year, and they were from cosmetology. They wanted something bill passed, and it came through my committee, so I was helping them with that. Before they left, they said, I want to thank you. I want to thank you for trying to pass Medicaid expansion. These people had health insurance through their company, but they thanked me for doing this. And they didn't have to do that because we wasn't there talking about that. So people want to see that happen in the state of Tennessee. If it doesn't happen in the state of Tennessee, shame on us.
I think that's an important point too. And somebody had just posted that in the chat that we shouldn't forget to thank the people who are actually doing this. I think a lot of times our tendency is to complain at the ones who aren't, but it's definitely worth taking the time to thank people who are fighting for something so important as well. So thank you, both of you, for the work that you're doing and for joining with us today. Any last minute questions? We also got a note. Apparently there's a tornado warning in Nashville right now. So for those of you who are here, there's a tornado warning until 1:15. It looks like the tornado is moving north.
Leslie, I do have one quick question.
Go ahead.
Sally and Ron, thank you so much for your advocacy and your courage. But specifically, I do like the idea of trying to find out who their personal clergy is, giving that clergy talking points and making if my rabbi called me, I'm listening. But there's one thing that we get back all the time, and that is not the immediate expense that the state might have to contribute if we adopt Medicaid expansion, but over the long run, these legislators are saying to us, it's going to cost us money. And increasing over the years, our percentage of participation will go up. How do we respond to that?
That is not true. And the studies from those that expanded in 2014 are pretty clear about that the match is 90-10.
Right.
And in Tennessee, that 10% was guaranteed by the Hospital Association. So there was no cost. And then what you do is you find savings across those areas I mentioned earlier. So what if you, and I can send some studies that have been done that states are showing significant savings above costs. So the 10% is covered, plus there's all this other savings from, like I said, the inmates, the mental health, the less opioid, more people on expanded get smoking cessation treatment and stuff. So less smokers, so less sick people. It's across the board. You see benefit economically as well as in health.
Does that 10% go up over time?
No, it is locked.
That's the
It's
fallacy.
locked.
We
Yeah,
keep
there
hearing
is no
so-
movement on it. And that was one of the reasons, actually, that was something Beth Harwell told me is, well, what if we do it and then we can't do it anymore? And I think the response kind of like was, so would you not feed a child today because you may not be able to afford food in 2 years? I mean, it's like, let's take care of people. And once you get them healthy, a lot of people aren't able to work right now because they have a health issue. They need a surgery, they need a something. Not everything, the ER doesn't have to do everything. There's a lot of things you don't get done in an ER visit. Any kind of chronic medical condition, surgery for an orthopedic issue that might be preventing you from work.
All right. Thank you again to both of you for being with us today on our Lunch and Learn and discussing this very important issue of Medicaid expansion in Tennessee. I think we've got a lot of people on the call who are very excited about helping you in this cause as it picks back up over the fall and certainly in January. So we'll be in touch, and thank you again for being with us today. Next week, we will have Jerome Moore from NOAA, which is the Nashville Organized for Action and Hope, and he'll be talking with us about NOAA's efforts to expand criminal justice reform. And then the following week on September 11th, we have Ben Sheehan, who will be discussing his new book that is called, and Deborah's holding it up. Michal, maybe you can shift to Deborah so people can see the book. Yes, there. So it's called, no joke, OMG, WTF does the Constitution actually say? And it's kind of a lighthearted but serious look at what really is in the Constitution, since it seems a number of people, both politicians and lay people, don't know. So those are our two upcoming events, and then we'll be taking a little bit of a break for High Holy Days and then back later in the fall after Rosh Hashanah and Yom Kippur and Sukkot, and we'll have more to report then. Thank you again for everyone for being on the call, and have a great week, and Shabbat Shalom to all who are celebrating.
Thank you, Representative Travis, for taking your time. And thank you, Sally, also. Thank you both so
Thanks,
much
Deb.
for joining us.